this is, of course, very important as well, because we've had this idea that perhaps we are diagnosing patients too late, and at that point, then any therapeutic intervention may not be effective or may not be so effective because it's too late. So we need to detect the disease earlier. And also for a while now, we've been paying attention to non-motor symptoms that seem to appear before the onset of the motor symptoms. And that's already an advance. But of course, we need better diagnostics. And in this respect, there's a lot of effort being put into identifying possible biomarkers in CSF, in the blood, in other body fluids, in the tears, for example. So this is an area of intensive research where different colleagues are really trying to find out biomarkers for the disease. Another important area is imaging. So as we become better at imaging the brain, we develop tools and reagents that enable us to see the pathology. So this is already happening in Alzheimer's disease, where we have compounds that we can use to image the plaques in the brains of Alzheimer's patients. And in Parkinson's, we still don't have these agents, these dyes that we could use to image the Lewy body pathology, but there's also a lot of effort being done to try to develop such agents. So this is an area that I think we'll see progress in the coming years. So altogether, I think we will hear about imaging markers, biological markers for the disease, and then, of course, other developments on scales and ways clinicians have to try to detect the disease earlier. Of course, with the aid of all these technological gadgets we have today, like the wearables, the cell phones, the watches that can track our movement. I think this will also be important to pick up the fine alterations that take place in patients before the overt onset of the symptoms that are more characteristic of the diseases.